What we're going to do now is a P to A mobilization of his posterior hip capsule. So if you know from the Craig's test, we're going to palpate greater trochanter and then just slide medial to that. Right there is his posterior hip capsule. So there's different ways you can do this. You can put hypothenar eminence along his posterior capsule, or you could just go forearm across. I prefer to get a little bit more direct contact. And then we're going to wind him up through in-range external rotation. Now, he doesn't lack extension as much as a lot of patients that I've had, but what you can do is take a little prop. It doesn't have to be a half foam, but just something like a rolled up towel. Put him through more hip extension, external rotation. So right here, we get a nice firm stop. So what I want you to do, Randy, is you're going to push your ankle out against my hand. Okay, good. And then you're going to relax. So we're just going through some contractile acts. We're bringing him through in-range external rotation. He's contracting through internal rotation, push out. He's holding that for 4 or 5 seconds and then relaxing. And then we're going to do it again. I personally like to do this 4 or 5 times, and each time, relax. We're just winding him up a little bit more at in-range. Do that again. Now in the clinical setting, I would usually hang out here, relax, and mobilize him before doing a bunch of contractile acts, but I do find that the contractile acts aspect is what gets you through a lot more range of motion. Okay, and then from here, we're going to just do a nice in-range hold. So I'm going to take my hands off. You're going to keep your leg in that exact position. And now from there, you're going to pull your ankle into my hand. So pull in this way. Okay, and then I'm going to cue him. I want you to push your hip flexor down into the table. Keep pulling your ankle into my hand. Perfect. You feel glute squeeze right there. Okay, and then we're just going to hold. So anytime you're mobilizing someone and you're working them through new range of motion, you always want to work on stabilizing through that new range of motion. Keep pulling in a little bit. Yeah, there you go. And then keeping that hip flexor down. So I would have him hold about 45, 60 seconds is what I like to do. And then we can relax. And now we're going to reassess. How does this hip extension look? That's a lot better.